Hi, I'm Jan Taplin, one of the owners of A Plus Elder Care Assistance. The other owner is my husband, Bob. I want to thank you for your interest in working for our company. I hope that you will watch this video because it will help you to get an idea of what we are looking for in a caregiver and what you can expect for working with us. Because after you watch this video, you might decide that this isn't a good fit for you, and that's okay. We're very specific about who we hire, so we'd rather that you watch this video rather than taking the time to fill out an application only to decide this is not a good fit. We are looking for people that are kind, considerate, honest, trustworthy, dependable, punctual, hardworking, dedicated, and most importantly, people that have the heart for being a caregiver. So, do you go above and beyond what's expected? Because if you do, you're the type of person that we're looking for. We do not want people that have the attitude of, that's not my job, or I don't think that I should have to do X, Y, Z. One example is, I don't think I should have to clean that room because the client doesn't use that room, so why should I have to use it? Those are some things that we hear, and we're looking for those people that believe in going above and beyond. Now, are you flexible? Do you have flexibility in your schedule, or is your schedule pretty rigid? Because if you don't have that flexibility, we may not be a good fit, again, because we are a small and growing company and we may not have hours right away. So we do need some flexibility. And then are you willing to cover extra shifts, or are you the type of person that just says, nope, I'm going to do my shifts and that's it, and I'm not helping out extra? So we need team players that are going to step up and help out when we need the help. Now, are you also the type of person that might stop and rescue an animal that you see that is injured or hurt, even if you're in a hurry to get somewhere? If that's you, you're likely the type of person we want as a caregiver. Now, do you have your own reliable transportation? The reason that we want you to have your own transportation is so that you're not late for shifts because the Uber was late, or that you accidentally missed the bus and now it's a whole hour before the next bus comes through. Having your own reliable transportation is really important to getting to our clients. Do you have a clean driving record? Do you avoid drugs? And do you have a clean, like your criminal background is clean? Those, again, are things that we are going to do. We will be doing a drug screening, we'll be doing a background check. Even if you have your fingerprint clearance, we're still going to do our own background check. And then avoiding drugs. We want people that are as healthy as possible, and people that are using a lot of drugs, whether pharmaceutical or even legal marijuana. We want people that are on the top of their game and sharp when they are at work and even when they're at home. Now, are you healthy? Healthy mentally, healthy emotionally, and healthy physically? This job can be very demanding in all of those areas. You might be sworn at, you might be called a name that is offensive, you might have to grab a client that's falling and break their fall to the floor. You might, again, get called names or just have to deal with a really emotional situation like a client getting ill, or a client going on hospice and going through the dying process. All of these things take a very healthy person mentally, emotionally, and physically. So hopefully you fit all those categories so far, and if you do, keep on watching and let's see if this still sounds like a good fit. So I expect my employees to stay off their phones. I do not tolerate caregivers that are going to sit on their phone and mess with it. The only time you should be on your phone is if you are making a call that is an urgent call that cannot wait, that you've asked for permission to make this call, or that you are doing your caregiving notes. Other than that, we expect you to have your phone put away and not messing with it. You are there and getting paid to care for the client, not to spend time on your phone. We expect you to work when you're on shift. If you are not spending time with that client, we expect you to work, not to sit and watch TV when the client is napping. Although depending on the shift, of course, there are exceptions, but for the most part, we expect you to work when you're at work. And we want caregivers that will go above and beyond and not just do the bare minimum, because we have a reputation to be better than the best. And the way to do that is to do better than the best. So that's one way that we keep that reputation. So as far as driving goes, you have the right to not take clients in your car. And also you have the right to say you don't want to drive clients around. However, if that is the case, it is going to limit the people that you may be able to work with, because a lot of clients utilize us to get to and from appointments or to the grocery store and back and so on. So if you are not comfortable and confident with driving, we need to have that conversation so that we know which clients we can and can't put you with. Our starting wages, we have a grid. The grid system is set that you get paid based on your education and experience. Please do not come to me knowing what our starting wages are, which are 16 to 18 per hour, and try to convince me that you need more than that because of whatever your financial situation is, or because you're a great and wonderful caregiver. Our starting wages are what they are. And if you prove to us that you are the great and wonderful caregiver, then your increases will reflect that. But we keep our starting wages set following that grid so that the starting wages are all fair. Now, those wages are based on anything that's 4 hours or more. If you work a 2-hour up to a 4-hour shift, then those wages are $18 to $20 per hour. So shorter shifts, you do get paid a little bit more per hour starting wage. And again, you show us that you are great and wonderful, and we will increase your wages accordingly. So that's how we work that with the wages. And as I mentioned, we are a small and growing company, so we don't have a lot of hours to give at any given moment. So if you are the type of caregiver that does not have to have shifts immediately, and maybe we are your second or your third job, that's okay. But we just don't have the clients right now to offer X number of hours immediately. So again, if all of this is sounding good, keep watching. We are looking to build our team of caregivers. So we're looking to have caregivers that are on the roster, that when we get that call where that client's coming home from the hospital and they need 24-hour care, we can pull those people in and we can get those shifts filled. But if we don't have caregivers waiting for when those things happen, then we can't take those clients, and then we can't grow because we can't take them. So it's kind of this crazy eight, I guess, if you will, of having that balance of having enough caregivers and enough clients to match up. But we need those caregivers waiting for when the clients show up. And it's kind of an odd situation to try and balance, but that's why we want to hire people to have them basically waiting on the bench for when they can get tagged in. So to be clear about what to expect, you may not get hours right away, and you may not get hours for several months. So again, if you can take on a position where this might be the case, then keep watching. Because now you know what is expected and what what we expect from you and what you can expect from us. I hope that this clears up a lot of questions that you may have. And then I also hope that this video helped you decide whether or not you want to take the time to fill out the application. Thank you so much. And if you are that top-notch A+ caregiver, I'm looking forward to meeting you and doing an interview. So thank you again for your interest in working with A+ elder care assistants, better than the best.